Okay.
Administering injections. Check accuracy and completeness of each medication administration record, MAR, or computer printout with prescriber's original medication order. Check client's name and medication name, dosage, route, and time for administration. Recopy or reprint any portion of MAR that is difficult to read.
Okay. MAR looks fine.
Assess client's medical and medication history. Assess client's history of allergies.
Okay. Allergic to penicillin and codeine.
Check date of expiration for medication. Aseptically prepare correct medication dose from ampule or vial.
You're going to be using the medication that you just prepared for the previous procedure. So all of your vials are correct.
Observe verbal and nonverbal responses toward receiving injection.
I've already gone into the room. I've introduced myself to my client. I've informed him that he is going to be getting 3 injections. He is well aware of that. I've educated him on the medication, and he is aware, knowledgeable, and fine with receiving his medication at this time. No refusal.
Assess for contraindications. 1. For subcutaneous injections, assess for factors such as circulatory shock or reduced local tissue perfusion. Assess adequacy of client's adipose tissue.
So remember, you're always going to make sure that you assess your client's sites before giving any injection, because that's going to determine how that medication is absorbed.
2. For intramuscular injections, assess for factors such as muscle atrophy, reduced blood flow, or circulatory shock.
Correct.
Check label of medication with the MAR. First check.
Okay. So we've already had our first check for our medication. Doing that.
Check medication before returning to drawer. Second check.
Okay, you'll check it one more time. You know how much you're going to give, and then return it to the drawer. For your next med, same thing. Expiration, the amount, and return it to the drawer. And then the same thing with your 3rd medication. Okay.
Take medication to client at right time and perform standard steps. Close door, pull curtain.
Okay, so we're going to make sure we prepare everything. Okay, you're going to close and lock your cart. Close your MAR. And now you can go to your client's room. Knock on the door before you enter. Come in and introduce yourself, Mr. Johnson. My name is Annette. I'm your nurse for today, and I'm here to deliver your medication. We've been in earlier, so he's well aware of that. You're going to make sure that you wash your hands. Wash your hands, and then you're going to ID your client. Can you please state your full name and date of birth? It says his name is Jeffrey Johnson, and his date of birth is September 5th, 1930. And then I check that with his ID band, before I can check it with my mom. It is correct. I'm going to pull my curtain. I also look for his allergies. Remember, I said that he was allergic to penicillin and codeine. All right, so we're good, and I'm not giving penicillin or codeine.
Compare the label of the medication with the MAR one more time at the client's bedside. Third check.
Okay, so I do my 3rd check. at the bedside. So, and this is a time that you can educate him. If you like, you say, okay, I'm going to give you whatever the medication may be. You ask him if he's aware of the medication. He says, yes, I am. I get it all the time. Okay, you check the amount. You check the time. You go to your next medication. Okay, you have the amount, the time, the medication, and then your third medication. Again, making sure you educate your client on each med.
Explain steps of procedure and tell client injection may cause a slight burning or may sting.
Hey, Mr. Johnson, you said you've received your injections before. He said, oh yeah, I have this all the time. I'm aware.
Apply disposable gloves. Keep sheet or gown draped over body parts not requiring exposure.
I'm actually going to raise my bed at this time. To a good working height. Remember, you always want to use good body mechanics when working with your clients. Save your back. You're going to need it for a long time.
Select appropriate injection site. Inspect skin surface over sites for bruises, inflammation, or edema.
Okay, so Mr. Johnson is going to get 3 injections. He's going to get a sub-Q injection. Into his abdomen. Sub-Q.
Subcutaneous. Palpate sites for masses or tenderness. Avoid these areas. For daily insulin, rotate site daily. Be sure needle is correct size by grasping skin fold at site with thumb and forefinger. Measure fold from top to bottom. Needle should be 1/2 length.
Okay. You're going to pinch it in between your finger. He doesn't pinch very well. Okay. Making sure that you stay at least 2 inches away from his umbilicus. You don't want to deliver your injection right at the umbilicus. Also, you're going to be observing for other sites where the medication was delivered before, if there's any atrophy, how much adipose tissue he has, so that the delivery is not one that will be damaging to him.